Okay, so pronouns are sometimes one of those big scary things that really concern a lot of people. They're afraid that they're going to do it wrong and they don't want to offend anybody. So hopefully after this, you will be an expert. All right, so the top two, she, her, probably already very familiar with those, right? We're taught that she, her is associated with women and girls, and he, him is associated with men and boys. But right now, hopefully one of the biggest takeaways you get from this course is to try to drop your assumptions. I know it's hard, but check in where you have them and try to let them go. They're not serving you anymore. So it's not always the case that what we think someone, what they look like, what they're supposed to have as a pronoun matches what society has told us it should be. Okay. So my pronouns are she, her. I have a very feminine appearance. I identify as a woman, all that good stuff. But I definitely know some folks who look feminine, just like me, assigned female at birth, but their pronouns are they, them. They don't use she, her, and they don't want to be called ma'am or miss. Okay, so we can't always, well, we really can never judge a book by its cover, right? Okay, so they, them, and by the way, this is by no means an all-inclusive list, definitely not. But they, them is probably, in my opinion, from what I've seen clinically, one of the most common non-binary pronouns that folks use. So one of the biggest pushbacks that people get, though, is I can't use they, them. It's not grammatically correct. But that's not true. I promise you that you have used this as a singular. So even though we're taught to think that they, them is meant for groups of people, we've already used they, them as a singular. For example, right now, I'm here giving this course, and if someone calls me on the phone and my girlfriend comes in and says, hey, there's someone on the phone for you. And I say, I'll call them back, right? I don't mean I'm going to call multiple people back. I mean, I'm going to call one person back, but I don't know their gender. So instead of saying I'm going to call him or her back, I just say I'm going to call them back, right? And it's so interesting to me because in some legal documents, like through contracts or even like local laws, in one sentence, they'll use she, he, him, her, etc. And then another sentence, they'll use they. And they is really more convenient all around. So when in doubt, when you're not sure what someone's pronouns are, use they. It can never, not that it can never go wrong, but you're safer that in that way, okay? And it is definitely more commonly used as singular than you think. It's just a switch. And personally, I think the biggest switch is difficult when it's someone you've known for a long time. For example, my sibling, their name is Drew, and I grew up calling them she, her. And so now it's still, even though I do this stuff for a living, it's still a little bit of a change in the brain to make sure that I use they, them to describe them. But it is difficult, but it does get easier the more you practice it. And if you are trying to get the hang of someone's pronouns, you can practice, talking about them or even like talking to yourself about them and trying to use their pronouns. Or if they've changed their name and you don't want to use their dead name anymore, which we're going to talk about that, try and practice saying it until it becomes a little bit more of a habit, okay? These bottom two here are Z-Zier or Zay-Zier. Usually the top one is pronounced Zay-Zier and the bottom one Z-Zier, but some folks will flip it. So again, go by what your patient utilizes, always validate their experience.